Each week we look forward to receiving questions about health and wellness from viewers like you. And it's time to answer today's Health Matters question.
Hi, Dr. Santora. I'm Dennis from Brea. And I've been wondering, can my blood pressure be higher in one arm than the other?
It's normal to have a blood pressure difference between one arm and the other. The first time you get your blood pressure checked, it should be checked in both arms and use the higher systolic number as the true blood pressure. Remember, your blood pressure has the top number, which is the systolic, and the diastolic is the lower number. For instance, if you have a blood pressure of 150 in the right arm and 120 or 130 in the left arm, it's the 150 number. The higher number is your true blood pressure, and that's the one that needs to be treated. A normal differential number is about 10 points. If it's more than 10 points, then you need to be considered for vascular disease. You may have a blockage in the artery down the arm, maybe into the neck, and maybe elsewhere in your body. So if your initial blood pressure readings differ by more than 10 points between one arm and the other, consider a workup for vascular disease. The next thing you need to consider is, at least the first time you get your blood pressure treated, you should measure your blood pressure sitting and your blood pressure standing. There are some people, especially diabetics, who have a high blood pressure sitting, like say 150 systolic, and then they stand, it goes down to 110. You don't want to treat those types of people because the blood pressure will drop too low when they stand up. So remember, blood pressure should be checked in both arms. Treat the higher blood pressure, the higher arm. If the differential is more than 10 points, consider a workup for vascular disease. And the first time you start medications, check your blood pressure sitting and standing. There's lots of devices out there for home monitoring, but it's important to do it properly.